There are gorillas at the Atlanta Zoo that have tested presumptively positive for COVID-19. That's right. Now, we know that animals can get COVID-19. This is one of our latest examples. I'm going to give you all the details. I think it's important. I think it's also quite interesting. By the way, guys, I'm Dr. Jen Caudle, practicing family physician, on-air health expert, and video creator. Okay, so the Atlanta Zoo, this is according to their press release on their website, says that some of their lowland gorilla troops have tested presumptively positive for SARS-CoV-2. Of course, that's the virus that causes COVID-19. Basically, what happened was some of the gorilla care team members observed some symptoms in the gorillas they were caring for. The gorillas had coughing. They had some nasal discharge. They had some changes in their appetite as well in several members of the gorilla population. And once these signs were noted, well, the animal care and veterinary teams immediately decided to test them for SARS-CoV-2. Now, they took a few different samples from a few different places. They did stool samples, nasal samples, oral swabs as well. And they were tested and their initial testing came back presumptively positive. What they're doing, this is according to a press release, the date is September 10th. The zoo is sending out those samples to a lab, I guess it's in Ames, Iowa, to get confirmatory testing, to get confirmation. But this is what I think is really, I mean, look, all of this is quite interesting, to be honest with you. The zoo has consulted not only with veterinarians, but also human doctors as well that deal with COVID-19. And what I think is super interesting, and I didn't even know this, but the veterinary team, in consultation with other teams, actually is treating the gorillas who are at risk of developing complications from COVID with monoclonal antibodies. I think that's super interesting. As we know, guys, people who are at high risk for developing complications from COVID-19, who are infected with COVID, who are not yet hospitalized, many people that fit that category, people are candidates for monoclonal antibodies. So this is a situation where gorillas are being treated who are at high risk for complications from monoclonal antibodies. So I think that's really, really important. In terms of how the gorillas got the COVID-19, I think this is really something that I think anybody would wonder. The zoo says that while they can't know for sure, they think that there was a COVID positive team member who possibly transmitted the virus to the gorillas. The team member who they think might have transmitted it actually is fully vaccinated and was wearing full personal protective equipment, that's PPE, and was not symptomatic on the day of reporting to work. So, this is, I think, really important. And it brings the question to like, okay, well, can animals transmit COVID to people? Can people transmit COVID to animals? According to the CDC, the risk of animals spreading COVID to people is low. But we do know that COVID can be spread from people to animals in some situations, especially in situations where there's a lot of close contact. So we got to keep that in mind. And that's why, guys, if you have COVID or if you've been sick, etc., you should, suspected or even confirmed, either suspected or confirmed COVID, you should avoid contact with animals. That includes your furry friends, your pets, and things of that nature. That's important. Something I think is really important to note here is that the Atlanta Zoo has been authorized to use and was on a waiting list to receive the COVID vaccine that's been authorized and approved in animals. The vaccine apparently has arrived at the zoo, and the zoo will basically vaccinate its gorillas as they recover from their illness. They're also obviously vaccinating other animals as well. So see, animals are getting the COVID vaccine. Of course, we as people can get the COVID vaccine, and we should. I always say that, and I encourage you and implore you to get it. Guys, I hope this is interesting and helpful as well. It seems like our animal friends are in some cases not much different than us, at least in this situation it seems to be. Guys, I'm Dr. Jen Caudle, practicing family physician, on-air health expert, and video creator. If you have not subscribed to my channel and click the little bell for updates, please do. Guys, I'll see you soon.